A brand new study published in Pediatrics finds that after surgery, black children had greater odds than white children of developing complications such as sepsis and severe bleeding. Black children also had a nearly 3.5 times higher chance of dying within 30 days of surgery.
The study involved nearly 200 U.S. medical centers, proving that even apparently healthy kids suffer racial disparities in health care.
PNC's chief medical editor, Dr. Corey Aber, joining us now from New Orleans to talk about this disturbing issue. Welcome, Doc.
Yes. Good evening, everyone. It's a very disturbing issue, and especially for me, I actually am a doctor that takes care of children by and large. And, we've known this for a long time. This is nothing new. It is something that we have looked at with adults. I mean, Harvard's done studies to show that African-American men, when they come in for chest pain, that they are going to have an increased risk of dying because they're not going to get the care that their white male counterparts would get. And that's been a study that we've known about for 10, 15 years. But now that we've extrapolated that data, and we thought that was the way that it was going to be dealt with, when you look at it across the board, but the study to actually prove it is now out. And that's just a horrible thing to think, that not only are people treating adults in that way, which you kind of still shouldn't excuse in any way, but children that, you could say that a grown man could be more aggressive and treat you mean as a doctor, and that's why the white doctors don't treat them well. But with a child, children don't do anything and to exacerbate anything. So for that outcome to be that way, it's just horrible.
Well, and Doctor, talk about the fact that we're talking about relatively healthy people here, no comorbidities, none of that. These are just young black children who go through a surgical procedure and don't get the care that they need coming out on the other end. Anybody who takes a Hippocratic oath, such as yourself, would have to feel something, shouldn't they?
Yes, and that oath is the first do no harm, and so that should be the case. But when we talk about comorbidities, they don't have comorbidities, but there is a difference in the ability of a child to be taken care of after the person goes home. So if you go home to a house after a surgery that is a big, beautiful house, you have all the ability to get all your medicines. You have the ability to have a maid at your house where somebody's cooking the food. You have your own room. You have all those types of amenities. Then that you increase your odds. You have less stress. You have the best food, the best vitamins. It's a less stressful experience, and we know that when you are stressed, you have more of an outcome that is not as good as someone who's not. So when you start talking about, once again, we cannot run away the social determinants of health. When you look at those things, where we live, where we love, where we work, where we play, all those things come into real big play when we are talking about health outcomes. So whether it's a child or an adult, if you don't have the ability to take care of a patient post-op, you're going to have a worse outcome.
Is there anywhere that you can think of, any cities, any countries that are getting this right?
Countries that don't have high minority populations that have been oppressed for the entire time of their existence. And those places are very few and far between, because we do know that in some countries like a country like Norway, where there's not a lot of people that are non-Caucasian there, right? The people that don't do as well are people that are lower socioeconomic status, because once again, that is a social determinant of health. They don't have the race issue, but if you're extremely rich and someone else is extremely poor, which every country has that, sometimes the outcomes are a little bit different. Now, countries that have universal health care theoretically shouldn't have that, but sometimes they still do, because once again, just like everything else, there's always going to be, no matter how equitable it's going to be, there's going to be somebody that has more money, more power, more connections than someone else, and that's just kind of the nature of our world. It's sad, and some people have tried to do different things, communism, socialism, all these things, but even in communism, there was somebody that had more money than somebody else. Right. So it's a hard way.
Well, let me ask you this too, Doctor. With the COVID environment being what it is, where parents might not be able to be with their children in the hospital in the best case scenario for a surgical procedure, and you can't be a good consumer, I guess is my my question here. And you have to be, I've never been a doctor, but I've been a patient. And you have to be able to ask the right questions and to have that kind of access. Are you finding that black parents don't have the access to information that they need?
But the myths of the African American patient to the white doctor are very well documented. We have a higher pain tolerance. We don't take care of ourselves. We bring all this on ourselves. Our skin is tougher, so it's hard to get IVs. We don't get pain medicine. All these things are there, and see, you're also automatically judged. If one of my biggest pet peeves is African Americans when they bring a child in, and it's really not just African Americans. It's kind of lower socioeconomic status. When you get the white plaques in your mouth of a newborn, that's oral candidiasis, okay, or yeast in the mouth, and it's called thrush. Okay, black people call it thrash. Now, I'm not saying all black people, but I've seen it when people come to the office say my baby has thrash. I've been in a room with a bunch of white doctors, and they're laughing about the fact that, oh, they came in and said thrash. I wonder if we're gonna, that they're just ignorant, and they'll say stuff like that, and I'll happen to be in the room. And so they're automatically judging the person because they mispronounced something. That's why part of what this whole network is about, part of the Doctor for the People show, the reason why we have that is because I debunk these myths and also give us something to go home with to think about. You need to be able to, even though you shouldn't have to pronounce things right for a doctor to treat you well. But I'm telling you, in this reality, if you don't, then they're not going to treat you as well because they're going to think you're not as smart. They're not going to explain things to you, all these types of things. So that's why we have to start saying thrush as opposed to thrash. We have to be educated so that we can know these things, because no matter what we want people to do for us, until we start doing some things for ourselves and learning things, then we're going to be judged. And that's why that's my job with this network.
And you're doing a great job, Dr. Hebert. That's really wonderful points and deep conversation that we need to talk more about that. So for another time, thank you so much as always. We appreciate your time.
Thank you. Y'all have a great night.
Be safe, Doc.